Hello, my name is Dr. Dewan S. Raja. Today I will discuss about cellular adaptation from general pathology. We have multiple adaptation. We'll go through each of them with examples and with the pathogenesis. Let's start with hypertrophy. Hypertrophy is the increase in the size of an organ or tissue due to an increase in the size of the cell. So in a pure hypertrophy, there is no increase in the number of cells, it is the size of the cell. There is an increase in synthesis of protein and increase in the number and size of cellular organelles and DNA. Cellular organelles are the mitochondria, Golgi apparatus, rough endoplasmic reticulum, and the free ribosomes. These are the cellular organelles. Examples of hypertrophy: increase in the size of the skeletal muscle by physical exercise, increase in the size of the left ventricle due to hypertension or maybe due to aortic stenosis, aortic incompetence. Left ventricle is hypertrophied because of hypertension. In hypertension, excessive peripheral resistance. The blood vessel has lost elasticity. So the left ventricle has to work more than usual. That's why it is a compensatory hypertrophy. In case of aortic stenosis, it's because there is stenosed condition or aortic incompetence. The flow of blood from the left ventricle to the ascending aorta is impaired. So there will be, or also in case of incompetence, blood will come back again to the left ventricle. So as a whole, the action of the left ventricle is increased. That's why there will be compensatory left ventricular hypertrophy. Hypertrophy is the response of tropic signals or increased functional demands and is commonly a normal process. Okay, so if we look at the cellular adaptation, this is uterus, normal histologic appearance of the uterine cell, the myometrial cell or the smooth muscle cells, those will be hypertrophied. This is the normal uterus in a non-pregnant women. This is the gravid uterus. In gravid uterus, there will be hypertrophy. Also, there is hyperplasia. So in hypertrophy, we are saying that the smooth muscle cell size has been increased from this. So if we look at the cardiac muscle here, so this is the normal heart transverse section, left ventricle, right ventricle, endocardium, myocardium. This is the epicardium. So adaptation response to increased load, what will happen? There will be advanced myocyte hypertrophy. This is hypertrophic like that way. Okay, this is cardiac muscle cell. This is also called myocardial cell. This is the intercalated disc. This is the branching pattern. This is the centrally located nucleus. So this is adaptation. In case of hypertension, aortic stenosis, will get adapted myocyte, that is the myocardial cell, hypertrophy here. This is the myocardial cell has been hypertrophied here. Lumen has been decreased from here to here. This is the myocardium here in normal heart, myocardium from here to here in a hypertrophic heart. We may have reversible injury or initial injury. There will be reversibly injured myocyte, but eventually there will be chance of cell death. Okay, and here is the myocardial infarction. Necrosis has gone to the myocardial cell, replaced by the fatty cells or adipose cells. Okay, this is due to the obstruction of the left anterior descending branch of the left coronary artery, most commonly blocked artery in myocardial infarction. We have other artery, those may be blocked also. Okay, now I'll go to the hyperplasia. Hyperplasia is the increase in the size of an organ or tissue due to an increase in the number of cells, not the size of the cell. This is the number of cell increase, but the organ size is increased due to the increase in the number of the cell. It is often a response to tropic signals or increased functional demand. Causes include like that of hormone stimulation uterus. During pregnancy, you have a lot of estrogen, progesterone, HCG that will stimulate the uterus to grow by hyperplasia, also by hypertrophy. Bone marrow. In any region, there is release of the erythropoietin. That erythropoietin in high altitude living person or some person has other chronic disease, that erythropoietin will stimulate the bone marrow. Chronic irritation. Okay, in chronic irritation, skin may be thickened. Bronchus, the normal cell will be in bronchus and skin, there will be proliferation of the epithelial cell as in seen in the chronic bronchitis. Person who smoke, they may develop chronic bronchitis. There will be thickening of the inner layer of the bronchus. Okay, by hyperplasia of the gland and the epithelium. Chemical imbalance, hypocalcemia, lead to hyperparathyroidism. Iron deficiency may lead to goiter, very large thyroid gland. Even it may be caused by thyroid stimulating antibodies, as in Graves' disease. In that condition, also the thyroid gland is increased in size. Example, increase in the size of the breast during glandular proliferation, during pregnancy and lactation. Hyperplasia and hypertrophy occur simultaneously in the uterus during pregnancy. Okay, so what is atrophy? Atrophy is a decrease in the size and weight of the organ. Okay, so it is decrease in the size and weight of an organ due to decreasing size and number of the pre-existing cell. So cell number is decreased, cell size is decreased in atrophy. Causes of atrophy: lack of blood supply, disuse atrophy. If the body part is not used, then it will be atrophied, as in seen in a person with full plaster. In a fracture of the bone, when the plaster is open, then we used to see that the muscles are atrophied. Okay, so disuse atrophy, lack of nerve supply, no action of the muscle will be atrophied. Okay, not only muscle, also bone also go through atrophy if the muscle don't work properly. Okay, nutritional deficiency will lead to atrophy. Okay, aging process will lead to atrophy. Decreased hormone stimulation will cause atrophy, and also radiation hazard will lead to atrophy of the tissue where radiation is falling. Atrophy is thought to be mediated by ubiquitin proteasome pathway of protein degradation. This is one theory. Atrophy is characterized by the presence of autophagic granules. These autophagic granules come from the debris of the mitochondria, Golgi apparatus, or the endoplasmic reticulum. Okay, so some atrophy, we'll look at some of the atrophy here. Okay, atrophy. Here, atrophy of the brain. Here, atrophy of a normal brain of a young person due to atherosclerotic changes or Alzheimer's disease. Brain will be atrophied in an old person. Okay, that may happen. Okay, So this is the atrophic brain, this is the normal brain. Okay. Here again, exposure to radiation may lead to atrophy of the epidermis. This is the epidermis atrophy. And dermal fibrosis. Here we'll get dermal fibrosis. Okay, here we'll get dermal fibrosis, atrophy of the epithelium. Plus we'll get the blood vessel little bit dilated in the deeper layer. There is telangiectasia of the subcutaneous blood vessel. Okay. So atrophy, fibrosis, and blood vascular telangiectasia. Okay, with some definition to know those definitions. Agenesis refers to complete absence of an organ and its associated primordium. Aplasia refers to the absence of an organ due to failure of growth of the pre-existing primordium. Here, okay, so complete absence. Here, absence of an organ due to failure of the growth of the pre-existing primordium. Okay. Hypoplasia refers to incomplete development or decreased size of an organ with decreased number of cells. Primordium, earliest indication of an organ or part during embryonic development. Dysplasia, metaplasia, I have another video about these two in details. You have a chance to read them if you like. Dysplasia means alteration in size, shape, and organization of the adult cell, mostly seen in the cervix, uterine, maybe even in the lung cancer. Metaplasia, change in the type of adult cell in a tissue to form an abnormal for that tissue. That means one type of adult cell will be changed into another type of adult cell. Simple squamous, stratified squamous epithelium of the esophagus will be converted into columnar epithelium due to gastroesophageal reflux disease. So that stratified squamous epithelium is changing to the columnar epithelium. That is a type of metaplasia. Here, disorientation in size, shape, organization of the adult cell is seen in the cervix uteri. Okay, metaplasia and dysplasia again. Metaplasia, one type of cell is converted into another type of cell here. This is pseudostratified columnar epithelium. This is stratified squamous epithelium. Okay. This may happen in the respiratory system, in the bronchi. Okay, we'll get these changes in a patient who is a smoker. He is prone to develop lung cancer or any cancer, or esophageal cancer is also possible. Here we are seeing the pseudostratified columnar epithelium converted into the stratified squamous epithelium. Okay, this is the dysplasia, where it is found in carcinoma in situ. Suppose the carcinoma in situ means that the basement membrane has not been damaged. So there are changes here in dysplasia, shape, size, and the nuclear position. Everything is altered here. Okay, there is dysplasia. We are seeing a lot of mitotic figure because it is also pre-malignant like metaplasia. Both metaplasia and dysplasia may happen simultaneously in the lung cancer or just before lung cancer. Both may be together in the lung. Okay, and that's all about the cellular adaptation and definition of the adaptations. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.